cuff. This is made by Philips Respiratory. The side is where you're going to place the bacteria filter. Then you're going to attach the tubing. Your tubing should be no longer than 10 feet in length. There is a filter back here that you need to make sure stays clean. This is where you plug it in. If you have a battery, this is where the battery would go. What I like to do is cut a piece off, place this T adapter in between. That way it acts as a quick release valve. So if there's a lot of secretions coming into the tube, you can quick release without the secretions being blown everywhere. Put a 15 millimeter adapter. This will attach directly to the trach. You're going to turn it on. This is your exhale pressure, 45 centimeters of water. It's going to exhale for 1.5 seconds, or whatever it's set on. You're going to have a 2-second pause in between the inhale and the exhale, and the inhale pressure is going to be 40 centimeters of water for 1.5 seconds. Once you have placed the 15 millimeter adapter onto the patient's trach, you're going to press the therapy button. So inhale, exhale, and pause. This is cover your thumb over the port. Then you have inhale, exhale, pause is 1. Inhale, exhale, pause is 2. And you can see the colors up top. Inhale, exhale, pause is 3. Inhale, exhale, pause. 4. One more time. Inhale, exhale, pause. You're going to release. You're going to put this on standby. You're going to take this off the patient and suction. If you put it on and within the first couple of cycles you have a lot of secretions coming into the adapter, you're going to stop therapy, go ahead and suction, and then resume therapy. After the 5 cycles, you're going to place the patient back on the vent and let them rest. And you can repeat those cycles 3 to 5 times as needed. And once you're finished, you will turn this off. Then you can take this piece off, rinse it out, let it dry, and it'll be clean and ready for the next use.